Good day, folks. Thank you for joining us here at Your Health. On today's program, we want to talk about one of our most popular and powerful supplements, CoQ10 and L-Carnitine. These two substances help to provide energy to an energy-deprived heart. When our hearts become deprived of energy, we develop the symptoms of cardiovascular disease, and CoQ10 and L-Carnitine can help you with that. These substances are remarkable, and I know there are quite a few people watching today that could benefit from this. You may be suffering needlessly. Please watch today, learn from it, have a little trust, try something new. Your life could change from what you learned today. Stay tuned for that. First, our news. Women will call an ambulance for their husbands, but not for themselves if they're having a heart attack. Researchers from the Polish Registry of Acute Coronary Syndromes evaluated over 7,500 heart attack patients. All of the patients had a more serious type of heart attack called a ST elevation myocardial infarction. This type of MI is known to have a high death rate if not treated within 90 minutes of diagnosis. Of all the heart attack victims, 45% overall received the necessary treatment within the 90-minute time frame. However, among women, only 34% received treatment on time, a rate significantly below the rate for men. The researchers report the most common reason for a woman's delay in heart attack treatment was a failure of women to promptly notify others that they thought they were developing a serious health problem. The research was published by the European Society of Cardiology. Related research from Massachusetts General Hospital explains why not getting enough sleep leads to cardiovascular disease. The study found when we are deprived of sleep, our body's level of the hormone hypocretin drops, which causes endothelial dysfunction and an increase of blood vessel inflammation. Both results greatly increase heart attack risk. This study was published by Nature. Well, isn't this amazing, folks? Women are more likely to call an ambulance for their husbands or a house guest when they're having a heart attack. But if a woman develops chest, arm, or neck pain, shortness of breath, nausea, or any of the more subtle signs of heart attack, only 1 in 3 will sound the alarm for themselves. Now, this study looked at over 7,000 ST elevation type heart attacks, one of the most serious and deadly types of heart attack. With this type of MI, it is critical that full treatment is provided within 90 minutes or severe complications or even death may occur. They found about half of the men received treatment on time, but only 1/3 for the women. Also, they found the younger the woman, the less likely they were called an ambulance and got started on critical treatment. Ladies, be aware that when a woman has a heart attack, 64% of the time they have no prior symptoms. That's the vast majority. So ladies, awareness of this phenomenon is the only solution. If you do not feel right, if your symptoms are new, strange, or unusual, please sound the alarm. It could save your life. Also, we learned more about the mechanism of sleep deprivation-induced cardiovascular disease. Reduced sleep levels lead to reduced levels of hypocretin, which inflames blood vessels while disrupting control of blood vessel function. And both results greatly increase cardiovascular disease risk. America's fast food is even more unhealthy now than it was 30 years ago. Researchers evaluated fast food items at 10 of the most popular U.S. fast food restaurants in 1986, 1991, and again in 2016. They found entrees, side dishes, and desserts all increased in calories and sodium content, while entrees and desserts showed increases in portion sizes. Overall, they found a 226% increase in menu items. However, even with the trend towards more options, the options were less healthy than 30 years ago. The study was published by the Journal of the Academy of Nutrition and Dietetics. Related research from the University of Liverpool sought to determine the effect of social media marketing on snack and fast food on children's food choices. They found kids that viewed unhealthy snack images on social media consumed 32% more calories from unhealthy snacks and 26% more calories in total compared with children who saw no images of food items. This study was published by the medical journal Pediatrics. Well, folks, America has been calling for healthy fast food options for at least 30 years now, and we've received more options, 226% more options, but very few of them are healthier. Overall, fast foods now contain more calories and salt, and the portions are bigger than ever. And there is no doubt this trend is playing a role in our expanding waistline. Even though health experts have been calling for healthy fast foods, we are not getting these options for one basic and overriding reason. We, the people, keep demanding bigger and bigger servings with more and more sugar, calories, and food additives. This trend will never end until we make it end with changing dietary practices. Well, perhaps the answer can be found with our children. If we teach them to eat better over time, fast food restaurants will provide us with better options. However, we also learned from our second study, children's exposure to television and social media snack and fast food ads, well, it has a profound effect on their eating habits. Here we learn if a child ages 8 to 11 sees unhealthy foods on social media sites, they will eat 32% more calories from unhealthy snacks and 26% more calories during their next meal. It is interesting to note the study also found when kids see healthy foods on social media, it did not lead to increases in portion sizes or total calories consumed. Fascinating, isn't it? Well, today on Your Health, we will discuss the amazing heart supplements CoQ10 and L-Carnitine. Please stay tuned to learn more. Did you know cardiovascular disease is a major health concern for seniors?
BioInnovations offers CoQ10 and L-Carnitine to nutritionally support the heart. Today's special is buy one bottle at the regular price and get a second bottle free.
On today's program, we've discussed the many health-promoting properties of CoQ10 and L-Carnitine. We've also learned heart disease strikes women just as often as it does men.
BioInnovations offers physician-formulated CoQ10 with L-Carnitine. And again, buy one bottle at the regular price and get one bottle free. That's 2 bottles for the price of 1.
Order online at bioinnovations.net or call 888-442-2128. Let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker for Your Health at a Glance. High cholesterol raises your risk for cardiovascular disease, but it's just one risk factor among many. And the need to lower your cholesterol can be over-exaggerated. Everywhere in the media we see advertisements for cholesterol-lowering prescription drugs. It's a big business. Now, cardiovascular disease kills more Americans than any other disease, so we need to pay attention to all the risk factors for heart disease. Here's a prevention strategy. Besides lowering your cholesterol, treat high blood pressure. Stop all tobacco, manage diabetes, exercise regularly to stay fit, avoid sugar, eat fish and fresh fruits and vegetables. Take your daily vitamin and use omega-3 oils. Address all your risk factors, not just your cholesterol. For Your Health at a Glance, I'm Dr. Richard Becker. Every day, about 200 million Americans do not get enough of a key essential mineral.
That mineral is magnesium. The typical American diet does not supply enough.
And magnesium is so important. It protects bones and helps more than 300 different enzymes in the human body perform efficiently.
That's why BioInnovations offers chelated magnesium capsules for oral use and topical magnesium gel to be applied to the skin. That's 2 forms of magnesium to meet your daily needs.
Scientific evidence points to chelation as the best method of vitamin and mineral formulation.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health.
Because chances are you are one of the 200 million Americans who need more magnesium every day.
Again, that number is 888-442-2128. Call today. Ask about the AutoShip program for additional savings.
Welcome back, everyone. It's such a blessing to be with you today. I hope everything is wonderful wherever you are. Today's show is going to be quite informative. We get to talk about the amazing nutrients, CoQ10 and L-Carnitine. We'll learn how these nutrients can really, really help improve your cardiovascular health. So, Richard, CoQ10, What exactly is that? That's a strange word.
Well, it is a strange word. Another name for CoQ10 is ubiquinone. Scientists named it that because it's been found in virtually every living form on this planet. It's ubiquitous. And what this substance does is it helps our bodies eke out every smidgen of energy from the food we ingest. It's used in the electron transport chain and the conversion of glucose, carbohydrate, sugar energy that our bodies use, converting it to ATP. And ATP is how our bodies is what our bodies use to make energy. So it can do all our cellular processes. And CoQ10 helps to shuttle electrons. It helps to do that so that we get the most out of our foods. Now, it plays a critical role there in providing energy. And this is important because if our tissues, especially our high energy tissues, become deprived of energy, we develop symptoms. And specifically, we're going to talk about heart disease today and cardiovascular disease. If our heart is deprived of energy, we develop angina. And over time, we develop heart failure. Angina can lead to heart attack, heart damage, and even death. And so maintaining a ready flow of energy to our cardiovascular tree provides great relief from symptoms of heart disease and cardiovascular. That's the concept for today. But CoQ10 does more than just that. It also is a vital antioxidant. It prevents the oxidation of cholesterol, LDL cholesterol, preventing arterial plaques. It prevents the oxidation of cell membranes. Cell membrane oxidation, damage to the cell membranes, leads to early aging. Aging before your time, and the diseases that accompany aging. CoQ10 helps to prevent that. And it does it better. It prevents this oxidative damage better than any of the other ingested vitamins and antioxidants, such as vitamin E, vitamin C, and beta-carotene. These are excellent nutrients, but CoQ10 plays a vital role as an antioxidant. CoQ10 also helps to improve nitric oxide release, NO, nitric oxide. Now, what is that? Let me explain it to you this way. If you have heart disease and you experience angina, loss of oxygen into the heart, there's low oxygen levels, and you develop pain in the heart. You take a nitroglycerin pill. Nitroglycerin is converted by our body into nitric oxide, and what that does is it opens up the blood vessels to the heart so more blood can flow into that oxygen-deprived heart muscle, and it relieves our heart pain. Well, guess what? CoQ10 also improves nitric oxide. It's, in a way, allow me to be a little creative. Taking a CoQ10 helps to support your natural nitric oxide or your nitrate. You know, I need a little nitroglycerin for my heart. CoQ10 helps to support your natural nitroglycerin system. Does that make sense? It opens up the blood vessels. That allows your heart to relax. It doesn't have to work as hard to get energy into the heart muscle. It helps to relieve our symptoms. It improves endothelial function. Endothelial function is how our bodies control the blood flow in the arteries and the blood vessels down to the capillaries and in the small vessels. It controls the dilation and the flow. Endothelial function is a critical component of good health and cardiovascular health in particularly. CoQ10 also lowers inflammation. It lowers inflammation in the blood vessels. Inflamed blood vessels lead to cardiovascular disease. It helps to lower that. And it helps to prevent hypertrophy of the heart muscle. If the heart muscle has to work too hard, it gets big. And when it gets big, it gets stiff. It gets scarred. It gets sclerotic. And that takes a lot of energy because a tough, hardened heart muscle can't relax to fill up with blood. So you have the energy to contract the blood out. It also takes energy to relax the heart to pull the blood back in. And when your heart is enlarging due to chronic ongoing cardiovascular disease, it takes far more energy to open up and pull that blood back. CoQ10 helps to supply the energy to do that, and it helps to prevent the thickening of the heart. That's kind of an overview. Now, when people take CoQ10, what does it do for us? It lowers hospitalization rates. That's been shown in multiple studies. It lowers cardiovascular disease mortality or death from cardiovascular disease while improving your functional status, meaning you can walk across the room easier, and your quality of life. It does all of these things. It's been proven in good quality studies. Now, we make our own CoQ10. This is normal. Everybody has this unless you have an inborn error. You know, you inherited a genetic disease, and there are babies who do not make their CoQ10 like they should, and they really do struggle. But fortunately, that's not very common. We can make our own CoQ10. However, it is made by our biosynthesis. It's a complex 12-gene, 17-step pathway requiring at least 7 vitamins and several trace elements. By its very nature, CoQ10 production is vulnerable. We're susceptible with age, with medications, with disease. We tend to make less and less CoQ10. And low production is common. And the common test to assess your CoQ10 levels, they're difficult to comply with and get a good test result. They have improved methods now, but 10 years ago, if you asked for a CoQ10 level in an intensive care, you'd probably get a test result you couldn't rely on. And that's a common problem. So assaying your CoQ10 level can be difficult to do unless you know a lot about this subject. Low production is common, and accepted normal levels are often suboptimal. The doctor may do a test and say, well, your CoQ10 level is fine. Not really. The newest information says what we think is normal is actually too low. Keep that in mind. Keep that in mind. When CoQ10 levels are low, the symptoms of heart disease emerge. Disease status worsens. Chest pain increases. Shortness of breath. Dyspnea, trouble breathing. It's difficult. I just can't get my breath. Dyspnea with exertion or air hunger. Think of it that way. Fluid accumulates. The body aches. Fatigue, depression. High energy organs have the most CoQ10, the heart, the brain, the liver, the kidney, the high energy organs, they have the most. And here's another twist of this problem with CoQ10 is our most commonly used medicines to control and treat heart disease often lower CoQ10 levels. It's a side effect of the drug. The statin cholesterol lowering drugs, such as Lipitor, you've heard that one. Yes, one of the most commonly used medicines in the world. It lowers CoQ10 levels. Beta blockers. It's standard of care to give a beta blocker to a heart attack patient. It helps to prevent arrhythmias of the heart. Beta blockers lower CoQ10 too. Sulfonylureas for diabetes, these are frontline glucose-lowering agents. They lower, and diabetes is a major risk for heart disease. We really have to be careful with diabetes. But the medicines used to control diabetes lowers CoQ10 levels. Thiazide diuretics, the most commonly prescribed medicine to control our blood pressure. These are all cardiovascular drugs or cardiovascular-related drugs, and they deplete our CoQ10, leaving us even more susceptible. It's a real dilemma. But fortunately, folks, CoQ10 is a natural substance. You can get it over the counter. It is virtually side effect free, and it's readily available, and it's reasonably priced. And you can take it to improve your health. Let's go to our break. When we return, let's talk about the various scientific research that supports the use of CoQ10 in a variety of health conditions. We'll be back for the research. Did you know cardiovascular disease is a major health concern for seniors?
BioInnovations offers CoQ10 and L-Carnitine to nutritionally support the heart. Today's special is buy 1 bottle at the regular price and get a 2nd bottle free.
On today's program, we've discussed the many health-promoting properties of CoQ10 and L-Carnitine. We've also learned heart disease strikes women just as often as it does men.
BioInnovations offers physician-formulated CoQ10 with L-Carnitine. And again, buy 1 bottle at the regular price and get 1 bottle free. That's 2 bottles for the price of 1.
Order online at bioinnovations.net or call 888-442-2128. Let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker for Your Health at a Glance. Do you have a family history of a certain disease? Scientists are discovering that our genetic code plays a smaller role than previously believed. Only about 20% of disease is tied to our innate genetic code. So what determines the other 80%? The answer may lie in the emerging field of epigenetics. What is it? Epigenetics is a group of changing factors responsible for both how our genes are read and how they are then applied throughout the rest of the body. And this may explain why identical twins with identical genes can have different health problems. Researchers believe two of the main factors in epigenetics are nutrition and environmental exposure to toxins. So eat a healthy diet, reduce toxin exposure, and you may improve your own epigenetics. For Your Health at a Glance, I'm Dr. Richard Becker. Is your life out of balance? It may be. The average American consumes far too many omega-6s and not enough omega-3s. This creates an imbalance.
So what can we do to get back in balance? We can eat a healthy diet.
And most of us need to supplement with omega-3 rich fish oil. Fish oil contains omega-3s with DHA and EPA, fatty acids that promote good brain and heart health. So reduce omega-6 in your nutritional plan and boost omega-3 to get back in balance.
To help you do that, BioInnovations offers two products, the Fish Oil Complex and Omega 369, both formulated for your health and well-being. So how do you choose? For highest levels of DHA and EPA, choose the Fish Oil Complex. For a balanced formula, choose the 369.
Go online at bioinnovations.net or call 888-442-2128. Ask about the AutoShip program for additional savings.
We're back, everyone, having a great discussion on the amazing nutrients CoQ10 and L-Carnitine. We're still talking about CoQ10. This one is so important. Richard, you have research to share with us now on CoQ10 and its effect on the heart.
So if we are taking CoQ10 for angina or heart pain, as it were, the studies show if you take CoQ10, you will have less chest pain, you will need less medicine, less nitroglycerin to relieve your pain, fewer hospitalizations, and better performance on stress tests. You'll be able to get around better. If you have mitral valve disease, mitral valve of the heart, you take CoQ10, fewer irregular beats. This is one of the annoying things of mitral valve prolapse is you get these flutters. Well, what is that? Oh, it's my heart again. Well, you'll have less of that. You'll have better exercise tolerance and less fatigue if you take CoQ10 for your mitral valve prolapse or disease. If you've had a heart bypass, coronary artery bypass graft, 3 of 4 patients who have the bypass grafting surgery have lower glucose levels in their recovery. If your glucose goes up after surgery, it inhibits your healing. You want that glucose to go down. And since CoQ10 helps to process glucose into energy, it makes sense. You'll have lower glucose levels. That's a good thing. You'll have fewer arrhythmias, irregular heartbeats, because as the heart doctors always tell us, it's not so much the heart attack that kills us, it's the arrhythmias or irregular heartbeats after the heart attack that stops the heart. And so if you need a bypass graft and you are given CoQ10 in this process, you will have fewer arrhythmias. You'll need less medicine, less drainage from surgical wounds, which in general means you're healing faster, and fewer blood products required because it's common to have a blood transfusion after this type of surgery, and you'll have a shorter hospital stay. And at the cost of $20,000 a day, that is significant. And it's a 2-3 days shorter hospital stay. That's worth doing. If you have cardiomyopathy or diffuse disease of the heart muscle, heart murmurs or valve disease, this general category of heart disease, and take CoQ10, you will have improved ejection fraction, meaning your heart more efficiently pumps the blood out. It doesn't have to pump it twice to get down the road. Do you follow me? If your pumping out more with each beat. That's a high ejection fraction. That's a good thing. CoQ10 improves the ejection fraction. It improves the diastolic function, meaning the heart will pull that blood back into the heart more efficiently, because remember, it takes more energy to siphon it back than to pump it out. That's where it fails first. You'll do that better if you take CoQ10. You'll have less hypoxia or low oxygen levels, and if combined with selenium, the essential trace mineral, you will reduce your risk of death. If you have heart failure, this is what made CoQ10 famous, was the use of it in heart failure. Low levels worsen the disease. Low levels of CoQ10 worsen heart failure. This is an established fact, and it reduces your ejection fraction, meaning your heart's not pumping blood efficiently. It's a bad thing. Supplementing CoQ10 reduces your risk of death from 40 to 50%. Why is this not standard of care all around the world? You know why? I'll tell you why. It's real simple. Because it's not a patent-able drug. Nobody can patent this, so there's no mass profits from the drug companies. I understand this, and I'm not saying it's a wrong thing. But you have to understand you're never going to hear about this on the evening news. You'll never see an advertisement in your doctor's office. You know those magazines you have while you're sitting there waiting for your turn to be seen? You'll never see it there. You may see it in an alternative medicine magazine, something like that, or you'll hear about it from Dr. and Mrs. Becker. You're going to hear it from us because it's the real deal. 40 to 50% reduced risk of death in heart failure. Think of that, folks, what we could save, the people we could help. You'll be able to walk further. You'll be able to exercise longer. You'll reduce your disability rating. You'll have better stress test performance in heart failure. It'll improve your blood glucose and endothelial function. The function of that artery, again, is working better. And it reduces the time to enlarge, it increases the time to enlarge the heart. In other words, it delays and slows the disease process. Improves ejection fraction, less shortness of breath, less pain, and improved quality of life. Combined with selenium in heart failure, CoQ10 with selenium in heart failure, 4 years of extra life. 4 years. See, the sad truth, folks, is if you are diagnosed with heart failure, it is a terminal disease. It is considered terminal. Now, it's a longer term for terminal, but it is expected that you will die from this disease. But if you take CoQ10, that is delayed 4 years on average. And I believe if you do a lot of things, like we talk about on this program, to improve heart health and general health in general, it could be much longer for you if you do your part, if you do your part. Hypertension. Next disease category, high blood pressure, the #1 health threat to America. Many experts say this, and I think there's some truth to that. If you take CoQ10 for your high blood pressure, multiple double-blind studies show reduced blood pressure by 11 systolic and 7 diastolic points with reduced edema, swelling. That is as good or better than any of the approved drugs for hypertension. But it's not approved for that. I want to be clear. This is a nutritional supplement. It is not approved for the treatment of any disease. I don't care, but I'm going to use it anyway. I use it personally every day. I have cardiomyopathy. I developed it from cancer therapy. The chemotherapy damaged my heart, and I was in a bad way, and CoQ10 saved me. And my wife will attest to that. She saw it happen. I'm not promoting CoQ10 with my story. I'm not saying that. It's the truth. It saved me. I'm here today because of CoQ10, and I want you to take advantage of it too. What about atherosclerosis, arterial sclerosis, plaques in the arteries or hardening of the arteries? CoQ10 softens the arteries. It improves the function of the artery. Stress-induced cardiovascular disease. Think of the executive under the gun, burning the candle on both ends. 75% reduce of cardiovascular disease risk with CoQ10 combined with garlic. Those two together. You know, garlic's good for the heart too. Healthy patients, exercise tolerance. If you're healthy and in good shape, you will be able to work longer, harder, with less muscle injury, soreness, and oxidative stress. And guess what? There's a trend among professional athletes to use CoQ10 and L-Carnitine for this very purpose. You'll never hear about it because professional athletes do not want to reveal their secrets. It's their competitive edge. But I can assure you, I promise you, I guarantee you, the professional teams are using it. They know. They know. Healthy patients taking a statin drug for cholesterol, you take CoQ10 with it, you will have less aches and pains. You'll have improved muscle strength and aerobic threshold. CoQ10 helps to lower cholesterol. It improves the measures of glucose control in diabetics. Brain and nerve, it helps the brain. Remember, high energy organs have the highest amount of CoQ10. If it's depleted, the brain benefits as well. The eyes, glaucoma patients do better, and a wide variety of special niche uses. CoQ10 delivers energy to all organs, but especially the heart and the cardiovascular system. We'll be right back with more. Did you know cardiovascular disease is a major health concern for seniors?
BioInnovations offers CoQ10 and L-Carnitine to nutritionally support the heart. Today's special is buy one bottle at the regular price and get a second bottle free.
On today's program, we've discussed the many health-promoting properties of CoQ10 and L-Carnitine. We've also learned heart disease strikes women just as often as it does men.
BioInnovations offers physician-formulated CoQ10 with L-Carnitine. And again, buy one bottle at the regular price and get one bottle free. That's 2 bottles for the price of 1.
Order online at bioinnovations.net or call 888-442-2128. Let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. I'm Cindy Becker, and this is Your Health at a Glance. The next time you're buying meat, look for low-fat, uncured, unprocessed meat in its natural state. Why? A low-fat, natural meat diet could be the healthiest of all. Research from Harvard University compared processed meat diets with natural meat diets. The extensive study involved more than 1 million people in 10 countries. The scientists discovered a diet of processed meat that contains preservatives and nitrate-curing agents, such as bacon, sausage, and deli meats, increased the risk of heart disease by 42% and diabetes by 19%. They also found natural meats, free of these curing and preserving agents, did not raise the risk of heart disease or diabetes at all. So shop for lean, uncured meats free of additives and in their natural state. For Your Health at a Glance, I'm Cindy Becker.
Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with gastrodefense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128.
We're back, everyone, talking about CoQ10 and L-Carnitine. Isn't this just amazing information? Well, to help you get this amazing product, we have a fantastic deal. We have a buy one, get one free. That's today only, where you buy one bottle of the CoQ10 with the L-Carnitine, and you get a second bottle free. You don't want to miss that one. This one is the special formula, the triple absorption. We'll talk about that later. Really an amazing formula. Richard, there's a little bit more on CoQ10.
Well, there's actually a lot, but we don't have time to cover it all. So, you know, researchers wondered if CoQ10 helps the heart so much, what about other things? And let me just go through a quick list of things. CoQ10, if you combine it with the Mediterranean diet, it lowers total bodily inflammation. It improves bladder function and prostate enlargement. That's real important, men. Lowers PSA in healthy men, protects the diabetic kidney, improves male fertility, improves saliva flow in dry mouth syndrome, Sjogren's syndrome. Do you have that? it will help your saliva flow. It helps energy to these organs so they can work better. It makes sense, right? It combined with curcumin improves bone mass. CoQ10 and curcumin improves bone mass. Osteoporosis, pay attention, CoQ10 and curcumin can help you. Lessens the pain of fibromyalgia, lowers the risk of preeclampsia for expectant mothers, reduces the side effects of chemotherapy for cancer. Please, chemotherapy patients. It improves the MS patients' function. They have less fatigue. They have less inflammation in the brain. It reduces the oxidative stress in multiple sclerosis, CoQ10 and multiple sclerosis. It improves non-alcoholic fatty liver disease. Have you put on a little weight? Doctor says, I'm worried that your liver's getting fatty. That's not a good thing. CoQ10 will help you. Get out and take a walk. That's the most important thing, but take a CoQ10 with it. What else? It improves measures of control in diabetes, lowers blood pressure better with exercise. Many people are using exercise to lower their blood pressure. That's a good thing. I want you to keep doing that. But if you take CoQ10 with it, it works even better, even better. Big study. This is all new stuff, folks. 443 elderly men with cardiomyopathy. CoQ10 with selenium over 5 years. If you took that combination, 55% improvement in you're half as likely to die. If you have cardiomyopathy, take CoQ10 and selenium, half as likely to die over the course of that study. Fibromyalgia, reduced inflammation and pain for the fibromyalgia patients. Juvenile fibromyalgia patients, same thing, it helps them. If you have emphysema, COPD, take CoQ10 and you'll have less shortness of breath. You'll be able to walk further in 6 minutes. 6-minute walking test, that's a common way to assess it. If you have HPV, human papillomavirus, herpes simplex virus, and these are widespread, folks, most Americans have one or the other or both of these viruses, most. If you take CoQ10, vitamin E, selenium, and methionine, the amino acid methionine, you will get well faster. Your sores will heal faster, reduce viral load, and increased antiviral blood function in your system. So if you think about how CoQ10 works, improves energy flow to all of your organs, all your tissues, it makes sense that so many different things would improve with taking CoQ10. Does that make sense, honey? I want people to, you know, I get off in the clouds of science. I've studied this all my life. I know all the big words, not all of them, a lot of them. But I have to always remind myself, I'm talking to lay people. That is my purpose in life, is to help you. And I have to stay so you understand it. Do you get it? CoQ10 will improve your life if you have heart disease, cardiovascular disease, and a wide variety of other health conditions. There's no harm in trying it, because it's very well tolerated. Now, CoQ10 complements L-Carnitine very nicely. The two go together. Remember we said that CoQ10 helps glucose get turned into energy better. Well, L-Carnitine, an amino acid that our livers and kidney makes normally, but with age and disease, our ability to make L-Carnitine declines. L-Carnitine shuttles fatty acids into energy. It shuttles fatty acids into the mitochondria, which are the powerhouses of the cell, and it turns the fatty acid into energy. So we have glucose from CoQ10, fatty acids with L-Carnitine. Now, proteins can be converted to energy, but our bodies don't like to do that. They would rather use the proteins to build our muscles and maintain organ mass and do all the blood and all these other functions. If we're relying on protein for energy, it's usually a stress state. Okay, so these two are critical. Now, L-Carnitine helps to convert fatty acids or triglycerides in the bloodstream into energy. And here's the thing. The cardiovascular system, 60% of its energy comes from fatty acids. It's not so much from glucose, it's from fatty acids. You know, a little oil or fat in the meal sustains your energy. If you're a working person, physically work a lot, you need some fat in your diet. You need that to sustain your strength. L-Carnitine makes that process more efficient. L-Carnitine, when we supplement it, it also lowers your measures of total body inflammation. It lowers your reactive oxygen species, these free radicals that damage our cells. It lowers body fat and triglycerides, and you know why now? Because it helps turn triglycerides into energy, makes it more efficient. So it's going to lower the triglycerides in your bloodstream. Many of you are taking a drug to lower your triglycerides. Try L-Carnitine. That stuff's amazing for elevated triglycerides, a known risk factor for cardiovascular disease. L-Carnitine helps to lower glucose levels, fasting blood glucose, long-term glucose levels. It's great for the diabetic. Cradle to grave, proven scientific benefits for L-Carnitine. Now, let's go to our break, but when we return, let's talk about some of the studies that support the use of L-Carnitine in cardiovascular disease. Did you know cardiovascular disease is a major health concern for seniors?
BioInnovations offers CoQ10 and L-Carnitine to nutritionally support the heart. Today's special is buy one bottle at the regular price and get a second bottle free.
On today's program, we've discussed the many health-promoting properties of CoQ10 and L-Carnitine. We've also learned heart disease strikes women just as often as it does men.
BioInnovations offers physician-formulated CoQ10 with L-Carnitine. And again, buy one bottle at the regular price and get one bottle free. That's 2 bottles for the price of 1.
Order online at bioinnovations.net or call 888-442-2128. Let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
Our hope for you today. I'm Cindy Becker. Christian counselor Dr. Henry Brandt wrote, "To dwell above with the saints we love, that will be grace and glory. But to live below with the saints we know, well, that's another story." Throughout our lives, we encounter difficult people. These souls challenge the best of us. But the Apostle Paul suggested that we maintain our grace in spite of the actions of others. Paul wrote, "If it is possible, as far as it depends on you, live at peace with everyone." Paul acknowledged it may not be possible in all cases, but we should still do our best. Try to look at difficult people through Christ's eyes. Remember his sacrifice was for everyone, even those saints we know who challenge us. I'm Cindy Becker. This is our hope for you today.
Can you lower your risk of disease? The answer is yes. One way is by including fruit in your diet. Fruit contains valuable nutrients that can reduce the risk of heart disease, stroke, and even some cancers.
We've searched the world and found 4 fruits we believe are among the best. Noni from Polynesia, acai from the Amazon, and 2 new ones, goji and mangosteen.
These 4 juices each have amazing properties that make them great additions to your nutritional plan. If you're a diabetic or have chronic pain, these juices will help you feel better and have more energy. Plus, they help with digestion.
Now you can experience the health-promoting benefits of all 4 in one convenient package we call the Fruits of the World 4-pack. And remember, it's 50% off by the case.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128.
We're back, everyone. Just a quick reminder on that special today. I don't want you to miss it. The CoQ10 L-Carnitine from Dr. Becker's Bionutrients is buy one, get one free. Buy one bottle at the full price, you get a second bottle free. This is the amazing triple absorption product. Richard, there's a few more studies we need to get through.
Yes, we've been talking about L-Carnitine and how it's a beautiful complement to coenzyme 10 for heart health and cardiovascular health, and how CoQ10 helps glucose turn into energy. L-Carnitine helps fats, triglycerides, turn into energy. And the two together work very well to better supply energy to an energy-starved heart and cardiovascular tree. When we do that, when we supplement L-carnitine specifically, 27% reduced all-cause mortality, death from any disease. You're 1/4 less likely to die simply by taking L-carnitine. Isn't that amazing? You combine that with CoQ10, you have tremendous benefits. What about myocardial infarction in L-carnitine? If you take L-carnitine, it reduces infarct size. Let's say you're on this and you're highly susceptible to heart disease and you do have a heart attack. It does happen. Well, your heart attack size will be smaller and you'll be less likely to die from that heart attack. It improves the ejection fraction. The heart's beating more efficiently. It's pumping out more blood. Less likely to suffer a second heart attack. You'll have 40% less chest pain, less suffering. I'm all for that. And 65% less likely to have the abnormal heart rhythm that may end in your demise, the irregular heartbeats that are really so dangerous in a heart attack. You'll have improved healing after the heart attack, and you'll have better exercise tolerance. You'll be up and around faster. Isn't that amazing? And less risk of heart failure complications. Atherosclerosis and L-carnitine. One of the first uses of L-carnitine was for claudication. What is that? Claudication is an obstruction, usually in the lower extremities, to blood flow. There's an atheroscleromatous plaque in the arteries to the legs, and it blocks the blood flow. So it is, claudication is angina of the legs. You're not getting enough oxygen to the legs, so they begin to ache, just like angina causes pain in the heart muscle. Well, if you take L-carnitine, one of the early findings of L-carnitine, it improves your ability to walk with claudication. You would be able to walk anywhere from 23 to 123 meters further. That's about 135, 140 yards further. Now, for many with claudication, that extra 100 yards or so, that allows you to go to the grocery store. It allows you to walk from the parking lot to the church. It allows you to get around. It improves your quality of life just simply by getting around a little better. Claudication. There have been at least 25 studies now that show L-carnitine improves walking distance with claudication. Heart failure, improved walking distance. Cardiovascular disease prevention, reduced cholesterol, reduced triglycerides. It may dramatically reduce triglycerides. Lowers total cholesterol, lower LDL, lower LPA, lipoprotein A, which is really the best single predictor of future heart diseases, lipoprotein A. It lowers that. Cholesterol, it counts. I'm not saying ignore it, but pay more attention to your LPA. L-carnitine lowers LPA and your risk of heart disease. Raises HDL, improves endothelial dysfunction. Chronic kidney disease patients. Remember we said L-carnitine can be made in the liver and the kidney. If you have kidney disease or liver disease, your ability to make L-carnitine natively, your natural way of making it, is compromised. Well, if we give L-carnitine and CoQ10 to the dialysis patients, it improves their heart function and it lowers their heart attack risk. It is common for chronic kidney disease patients to actually die from heart disease. Ask any nephrologist, they'll tell you, my big concern is your heart, Mrs. Jones. We have to keep track of your heart. Well, L-carnitine helps in that setting, and so does CoQ10. That is truly good news, and there's a lot of science on this. Diabetes, multiple studies show improved measures of glycemic control. Your blood glucose gets better. Your triglycerides get better. Your cholesterol get better if you use L-carnitine to help you manage your diabetes. Asthma, improved symptoms in children with asthma. Who would know? Who would think that? It does. It helps them. Autism, proven some benefit. Now, I'm not saying it cures. I'm not saying that. But anything that helps the autistic child is good in my book. And it shows some benefit for the autistic child. Erectile dysfunction, I get this question a lot, men. Write this down. Here's your combination of natural products for erectile dysfunction. L-carnitine, arginine, which is an amino acid, niacin, vitamin B3. That combination, 77% improvement in erectile dysfunction. Pretty amazing, isn't it? And a lot cheaper than the medicines. Aging, double-blind, placebo-controlled study of 66 100-year-olds. These are the long-lived people of the world. This group, if they start taking L-Carnitine, it reduced their fat mass, increased their muscle mass, and increased capacity for physical and cognitive activity. Isn't that amazing? Even in 100-year-olds. Cancer, a review of 33 studies, almost 2,500 cancer patients. Those who take antioxidants, and L-Carnitine was one of those studied in this big study, they did better. L-Carnitine improves weight and prolongs survival for the cancer patient receiving chemotherapy. And, you know, cancer treatments are toxic. There's no two ways about it. If you take these energy-providing supplements, it helps to protect your organs during this. And the longer you stay healthy and strong, the more likely you can finish your treatments and beat this terrible disease. Side effects of both CoQ10 and L-Carnitine are rare and unusual, and usually relate to very high doses. And we'll have more about how you take it, how long you should take it, all those details when we return. Did you know cardiovascular disease is a major health concern for seniors?
BioInnovations offers CoQ10 and L-Carnitine to nutritionally support the heart. Today's special is buy one bottle at the regular price and get a second bottle free.
On today's program, we've discussed the many health-promoting properties of CoQ10 and L-Carnitine. We've also learned heart disease strikes women just as often as it does men.
BioInnovations offers physician-formulated CoQ10 with L-Carnitine. And again, buy one bottle at the regular price and get one bottle free. That's 2 bottles for the price of 1.
Order online at bioinnovations.net or call 888-442-2128. Let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker for Your Health at a Glance. High cholesterol raises your risk for cardiovascular disease, but it's just one risk factor among many. And the need to lower your cholesterol can be over-exaggerated. Everywhere in the media we see advertisements for cholesterol-lowering prescription drugs. It's a big business. Now, cardiovascular disease kills more Americans than any other disease, so we need to pay attention to all the risk factors for heart disease. Here's a prevention strategy. Besides lowering your cholesterol, treat high blood pressure. Stop all tobacco, manage diabetes, exercise regularly to stay fit, avoid sugar, eat fish and fresh fruits and vegetables. Take your daily vitamin and use omega-3 oils. Address all your risk factors, not just your cholesterol. For Your Health at a Glance, I'm Dr. Richard Becker. Vitamin D deficiency is at epidemic levels in the United States. Chances are you aren't getting enough of this essential nutrient. Vitamin D is one of the most important molecules in the human body. It's required for the proper function of nearly 4,000 genes and 1,000 metabolic chemical reactions.
BioInnovations brings you Dr. Becker's BioNutrients Vitamin D3. Now, supplementing with vitamin D is safe and affordable.
Studies show that vitamin D deficiency can lead to poor immune function, depression, cardiovascular disease, bone disease, diabetes, cancer, and much more. Starting supplementing vitamin D today for better health tomorrow.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. Your Health is brought to you by BioInnovations, trusted products for your health and well-being.
We're back with just a quick reminder. We have Dr. Becker's Bionutrients CoQ10 with L-Carnitine. Buy one, get one free today only, so don't miss it. So, Richard, let's talk about the best way to supplement with CoQ10 and L-Carnitine.
Well, it's easy to take by mouth. We've combined these two products together, CoQ10 and L-Carnitine. Each gel cap has 30 milligrams of CoQ10 and 250 milligrams of L-Carnitine. I want to talk just quickly about our form of CoQ10. We actually have used ubiquinol. We called CoQ10 ubiquinone. We used ubiquinol, and all that is, it's what we call the reduced form. It's charged and ready to go to work. Your body doesn't have to recharge ubiquinol. It's ready to go. And it absorbs better. And the way we formulated this product, you get triple absorption, so that a 30 milligram gel cap actually would equal 90 milligrams or more of some other inferior product. So it's a very cost-effective, efficient way to supplement CoQ10. It absorbs rapidly. It's in the reduced form, ready to go to work. You get the most bang for your buck. It helps make it more efficient. And the L-Carnitine, 250 milligrams, both of these substances, here's a study. Let's just tell you the study. 2,664 patients taking CoQ10. Less than 1/3% of all those patients had to stop CoQ10 from any side effect. The most common side effect at high dose is a little queasiness. Take it with food, you'll avoid most of that. But that's really high doses. 1,200 milligrams a day. Most people do not need to take that much to get their benefit. If you find you think you need to take 1,200 milligrams of CoQ10 or 5,000 milligrams of L-Carnitine, I want you to be under the care of a physician. Why? Not because it's dangerous, but because I want to know that the doctor thinks it's actually going to help you to take that much, and it justifies your expense. Because taking that much would get more expensive. And why do it if it's not going to make much difference? Does that make sense to you? It's not because it's dangerous to take it. I hear this all the time. Oh, those supplements are dangerous. Show me the harm. Show me the evidence of harm. Show me the facts of how many are damaged. It's not happening, especially with CoQ10 and L-Carnitine. You can take up to 10 of these gel caps a day. Past the 10, I recommend that you have a doctor involved. And you can have a doctor involved at any time. But up to 10 a day, take it with food, and particularly something a little oily, like at night, in the evening when you have your salmon. Take it then. Or in the morning, your peanut butter on toast, something oily. Or anything with a little fat in it will help you absorb the CoQ10 and get the most out of it. Very high doses are the only time we see these side effects. Yeah, but in general, it is very well tolerated. Well, honey, I hope people got the message. CoQ10 improves the energy flow to an energy-starved heart. It makes a difference. It reduces your symptoms of heart disease and cardiovascular disease in general. And as we've learned today, it has widespread application for a wide variety of conditions, even multiple sclerosis, Parkinson's disease, chronic fatigue, emphysema, on and on and on. So, I don't know how else to say it. It's from my heart to you. Please try the CoQ10. Less suffering, less dysfunction, more ability. Thank you very much for your kind attention. We'll see you tomorrow, folks.
Thanks, everyone. We'll see you tomorrow. Bye-bye.
Hippocrates once said, "Let food be thy medicine and medicine thy food." So why do 9 out of 10 of us not eat enough vegetables daily? It's because we don't always know how to incorporate this practice into our busy lives. Instead of removing bad foods, start by adding healthier foods you prefer. You'll soon discover better foods you love will crowd out unhealthy cravings. It's not crazy, just healthy.
You know, the world is changing. You watch it on television every day. It's unbelievable. It's unthinkable.
Today on Love a Child, we are helping people. No matter what is going on all around the world and all the bad reports you hear, there's good reports happening here. God raised you up